topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas-Fort Worth. I am so sorry that you're having all this cold weather there. That was one of the reasons why I moved away from Dallas to sunny Florida. I'm not going to rub it in at all, but hey, listen, stay warm, stay safe. We've got a great show for you today. Let me introduce you. God, she has become such a fan favorite. Let me introduce you to Dr. Daniela Gamboa. Good afternoon, Dr. Gamboa.
Hey, Steve. Thank you for having me. How are you? Yes, we are.
You made it.
Yes.
I was worried about you because my family keeps telling me about the icy roads there and how cold it's been there. Looks like you're in your office. So I'm glad you made it.
Yes, finally, today we decided to open the office, even though we didn't have a lot of patients. We still did some telehealth, but we were at home yesterday, Monday and Tuesday, and it was interesting. Yes, we did telehealth, but the roads are very icy, like this morning were worse. Now I think they're getting a little better. But at night, I think it's going to drop below 32 again. So there we're going to have the ice again. So, yeah, it's one of those things here in Dallas.
This is going to be probably a lot of people getting colds, right?
Yes, and not only cold, like me myself, like 2 weeks ago or so, I got the flu and strep. So, yeah, I got double whammy. It was pretty bad. But I cannot imagine how bad it was going to be if I didn't have the vaccine for the influenza. I did have the whole like body aches, chills, fever, and of course I had two infections in one the virus and the other one the bacteria from the strep. So both of them were like doing all those things to me. But thank God everything was like lasted for probably like 4 days. And then it was better. But yes, I'm seeing a lot of flu, COVID still, and strep.
Well, we got so many letters. We missed last month's show due to the holidays. So I've got actually 2 months worth of letters.
Okay.
We had actually about 6 or 7 letters, Dr. Gamboa.
God,
people wanting to know how they can raise their immune system.
Like that's an excellent question. And raising your immune system, of course, starts with like eating less processed foods, and having all your supplements. Vitamin D is an excellent immune booster, and we learned about this whenever we were going through the COVID, and we were seeing that the worst outcomes were whenever like the patients were having a very low vitamin D. So we started like checking, replacing it, and it's a very good booster for the immune system. Zinc is another one that is excellent immune booster, and of course the good old vitamin C that we all know. But also with the vitamin C, we cannot, and with any vitamin, we cannot overdo it. Too much vitamin C it's bad. Too little it's bad. The same thing with anything, with the iron, with the vitamin B12. So we always have to have the optimal levels, and we cannot just go too much of anything.
We got a letter from Grapevine from Millie, and she said, I take a multivitamin every day, but I don't feel like I'm getting enough. I'm just getting a little bit of everything. What other areas should I concentrate on? I'm 45 years old, very active.
Okay, no, that's an excellent question. And Millie, thank you for your question. And you are right. Whenever it says multivitamin, they have a tiny bit of everything, right? So they have to basically, if you think about it, it's like 12, 14 vitamins in one pill. So they have to have a little bit of everything. So this is a good for maintenance. But what you really need to do is like whenever you go to your doctor, ask them to check for your vitamin D, for your vitamin B12. If you're 40s, then also we have to check for your iron deposits, because whenever we're in our 40s, like females, we get into the perimenopausal time, like your hormones have a lot of changes, and sometimes because of those changes, then we can have very heavy periods. So even though like your blood count or your hemoglobin is not showing anemia yet, but your iron deposits probably are very low. And if you're active, we definitely have to make sure that you increase your protein intake, you have vitamin B12. If you're doing some resistant exercises, let's like recover your muscles with a little bit of creatine, that can help you also with that recovery. So ask your doctor to check for at least vitamin B12, vitamin D, and your iron levels.
This is from Carrie. I don't know if it's a male or a female. She wants to know what non hormonal factors can contribute to low sex drive.
That's an excellent question. Like also it depends on the age, because like as we know, and I was recently in I was supposed to be in Florida, Steve, like last 2 weeks or so. Whenever I got sick, I was going to go to this conference in testosterone and sexual health. And unfortunately, I was not able to go because of my illness, but I was able to still live stream it. And I was able to like listen to all these excellent lectures about like the gurus and testosterone, Dr. Morgan Taller, Dr. Mohit Kira. He's like an expert also like in Houston, in Baylor. So all this, and Dr. Rubin, these people went also to the FDA panel of experts, and advocating for women's health, for men's health, like asking them to have the testosterone be like less restricted. And also like as a consequence of this and all this advocating they did, also like if you heard, they removed the black box warning on the estrogen, like, and all these good things that they're happening. But going back to the question, is like there are many factors that they can affect the sexual like desire, drive, and libido. So what happens is like at the age of 30 and the women, the testosterone starts going down. And the same thing happens with guys, like with each year, like there's a percentage of like testosterone that starts going down. Stress can of course like play a huge deal with this, because like stress is going to make your cortisol levels go up. So everything is going to miss all this, and that's also going to interfere with your sex drive. Then so we have lack of sleep, like irritability, like anxiety. So many things is not only the hormones. So we have to check and see what is going on. Same thing happens with erectile dysfunction, like is the patient having obstructive sleep apnea? That can also interfere with the erectile dysfunction. Not only
Wow.
testosterone, of course, our number one is going to be our testosterone levels, but definitely we have to check all these other factors that can interfere, because hormones is not everything. Yes, it's a big part, and we have receptors in all our body for the hormones, but we have to also look at other possibility or organic causes of what's going on.
We just got a text from Rona. She wants to know, I just found your show. What areas do you treat in your practice?
Oh, thank you for the question, Rona. Yes, my practice, I am a family medicine doctor, but do a lot of functional medicine. I treat the patient from the inside out, basically treating the whole person, not only one symptom at a time. So we take care of everything. And we do hormone replacement, bioidentical hormone replacement. I also do weight loss. I am a diplomat of the American Board of Obesity. And I treat patients with obesity, like looking for different causes of the weight gain and help them with the weight loss therapies. Then also, like as a part of all this, I also do some aesthetic treatments. We do chemical peels. I have lasers. I have like ZERV. That's the newest thing in Canada and in Korea that helps tightening the elastic bands of your skin, so to speak. It's not only the collagen, and we also treat the muscles of your face with M-Face. So the face, if you think about it, it's a structure like a house, right? So we have the we have all the pillars, we have all the base of it, and then we have to put the insulation, then we have to put this and that layers. Same thing with your face. We have the bone structure, the muscles, the fat pads, then it comes to the skin. So we cannot only treat the skin by itself. So we have to go and treat the muscle that's going to give the support for the fat, that's going to give the support for the skin. So everything works together.
Dr. Gamboa, God, we got a lot of questions on ED and low libido. Here's a question from Fort Worth. When one of your patients presents themselves with low testosterone, ED, or low libido, how do you decide on the right combination of therapies?
Oh, excellent question. So that will it depends on, number one, the age of the person. For example, if you're having this patient that is younger, is in the 30s or 40, like early 40s, and it's coming with all these three problems, then I have to like ask him like the stress that he's having in his life, what is going on in his life, does he snore, is he overweight, all these things that I'm going to see that can affect the libido, that can affect the erectile disorder, at the erectile function. So, and then once we find out, it's not only directly to give them testosterone, because if you give testosterone to a young patient that doesn't have any kids, or if he had kids and he wants to have more descendants, then I cannot give you directly testosterone, because guess what's going to happen? I'm going to cause infertility problems, because if I give you testosterone and you're young and you want to have kids, the testosterone is going to give the feedback to your brain that your testicles don't need to make any testosterone or stimulate the testicles. So the sperm production is going to go down. So that's what happens whenever you're young and then you receive testosterone. So we don't do this because we know this can happen. But if the guy says, I'm done having kids, I already had a vasectomy, he's in his mid 30s or 40s, then of course I'm going to replace I'm going to give him the testosterone. I'm going to give him testosterone therapy, because that's going to be the best for him to get better with the libido, the fatigue, the erectile dysfunction. If the patient is older, also I have to see, does this patient have high blood pressure? Does this patient have diabetes? Because all these other factors can contribute for the erectile dysfunction, because as we know, like hypertension, diabetes, they're going to do micro problems, or like to the micro vessels, blood vessels, that are going to affect the blood vessels, and then you're going to have erectile dysfunction. So it depends on the age, it depends on like the chronic problems. That's how we determine what and how I'm going to help you with, because it's not only, again, the blue pill, that's Viagra. Not everyone needs that. That's like a little band-aid, but we have to find out why you're having the erectile dysfunction, and that's the Viagra is only going to help with the mechanical part, but the Viagra is not going to help anything with a sex drive, with all these other things. So like we have to see what's causing it, like how can I help you. But the number one thing that we try to do first is a testosterone low, and everything goes from there.
This is from Lily. She is in Arlington. Said, I listened to all your shows. Thank you so much. You provide such great information. You've mentioned that many of your patients are doing everything right and still not losing weight. Why does that happen?
So sometimes it could be many factors, Lily. It could be that they're stress levels are too high, their cortisol levels are higher, so that's one thing that causes a lot of these problems. The other thing is, what if my patient is having a night shift and working at night? So that also the circadian cycle that causes a lot of problems that can interfere with your weight loss. Then the other things is like, are we not finding a occult um, adrenal adenoma? That means that your adrenal glands are going to be making too much cortisol, that's called
Mm.
hypercortisolism. So like we have to, like, again, like if you're doing all the right things, you are committed, you're going to the gym, you're eating what you're supposed to, and you're still not losing weight, we have to find out what else is causing. Are you having some abnormal hormonal abnormalities? Because now we know that menopausal women, whenever your estrogen goes down, your insulin resistance goes up. So then that's the reason why that's the whenever we are in perimenopause and menopause, we gain weight. And mostly in females, they gain weight around their belly, because again, we don't have estrogen, our testosterone also goes down, the visceral fat goes up, and our insulin resistance goes up. So that's also the reason why we gain weight in those like changes of life.
Dr. Gamboa, you talks a lot about supplements. And here's a lady. She said, Dr. Gamboa, I am so confused. I go into these supplement stores and you ask them, for example, vitamin C, and there's 10 different vitamin C's, all different prices. Bet you some people go to the highest price thinking it's the best. What is your opinion on different supplements? How do you choose what supplement? Are there certain name brands that are better than others? That's a
Yes,
good
that's
question.
an excellent question. Thank you. So yes, it's the supplement industry is a multi-billion-dollar industry, and we have to be very careful, because what happens is that there is some overseeing in the supplements, but it's not as strict as an if the FDA's checking for the prescriptions. So with the supplements, it's a little bit different. They have different kind of like overseeing, but you always have to look for the brand that has a third party that is checking for the purity, and also is checking for like making sure that pill number one is going to be the same and has the same ingredients like pill number 1000. And they do like this um, random, like what do you call it, auditing on this product. So you have to have like some brands that they have this. So I would say like some brands that I like, that's Nature Valley. The other one would be the Thorn, has like very clean products. Another, I like to use what we call, it's like a virtual dispensary. It's called Full Script. And this Full Script, they try to screen the cleanest and purest supplements, the ones that they don't have a lot of additives, they don't have all these banned substances or anything like that. So they try to look for this brands. Pure is another one. Pure encapsulations, I believe it is. Then it's Thorn. I like Thorn a lot, especially the creatine. That's the one I recommend for my patients, because also that's like approved by the NSF. So that means that it's safe for the athletes to take it. They don't have any extra like additives or anything to make it dangerous, or for them to be banned. So it's like that's one of the purest and most tested like a creatine that I know of in the market. So that's one of the best ones, Thorn. Thorn also has a lot of different like ingredients that have good. Da Vinci Labs is another one that has very pure ingredients. So you have to always look for that, because it's very confusing.
Yes.
And sometimes they tell you, oh, this chewable is better than this, and everything has to be depending on how you are, or depending on your chronic medical conditions. For example, someone that has had a bariatric surgery, it doesn't matter how much vitamin B12 you take it by mouth, it's not going to absorb. It's not going to be ever enough because they cut a portion of your stomach. So then a portion of your stomach where you had all the substance, that is the intrinsic factor that helps absorption of your vitamin B12. You don't have that portion anymore. You don't have that extra substance. So of course you're not going to absorb no matter how much you're going to take it by mouth. So that's why, like, whenever you have a bariatric surgery, we always have to give you a sublingual, meaning that it's going to be in the under your tongue and you're going to absorb it through the mucosa instead of going all the way down your stomach. Try to get absorbed. So, or by the nose, there's like it's called Nascobal. There's like a prescription spray to your nose that it's like the vitamin B12. Sometimes it's very difficult to get that approved by the insurances because it's not cheap. But like the easiest one, of course, not everyone wants like the injections, but vitamin B12 injections whenever you don't have enough and you are, or you have like a bariatric surgery or any kind of like absorption problem, then that's how you have to do it. And again, like all the different, for example, iron, all the types of irons are going to be different, like one is going to cause more constipation than the others. So you always have to see what's going to work for you, but always again look for the ones that have less additives, more testing, and a third party that is going to always check for purity and to be a reliable like product.
Dr. Gamboa, some people get misled. That's probably the best word. They think that some of these supplements are FDA approved, when in reality, it's the lab they're made in is FDA approved. And that's not such a big deal as an actual product because from what I understand, it takes years and years and years to get a product approved by the FDA. They're not the fastest, but some people, yeah, I bought this because it's FDA approved, but it really wasn't. It was FDA made in an FDA approved lab. There's a big difference, right?
Yes, and also, we have to always like remember that the supplements, and you're right, Steve, whenever they say FDA approved, or whenever like there's like the prescription medications have to go through a rigorous
Yes.
process, like, and they have to do the trial. So that's why we always like take so many years for that medication to be approved. The same thing that is going on right now with the weight loss medications. We're still waiting on the trials, like to like come up new medications, because it has to go first on the lab, then it has to go to the phase number 1 trial, phase number 2, then it has to go to like the consumer, and then it has to go like after like seeing if there's not a lot of adverse effects, if they're safe, if they are safe, and then whenever they pass all this things, then they're like, okay, yeah, we can approve it, and it goes that. And that's why like the prescriptions are so different from the supplements, because the supplements, that's why everyone has to say this is not by the FDA approved for treating or any conditions, because again, they didn't go through all this phase 1, 2, 3 trials that are going to demonstrate that they can like go ahead and improve a condition, like, so yes, they can help us, and some supplements are better than others, are more pure, or also like are going to help us, but some other ones are like really not going to do much, and it's just marketing, because there are many products that they don't absorb well, but they still tell you, oh, this is going to help you with this and this, but in reality it doesn't absorb well. One of those is like NAD, that there may be some oral medications that they swear by it, but in reality, if you see how like the NAD works, it's not really well absorbed orally. So the best one would be IV, but then the best next choice would be a subcutaneous injection, but again, like there's a lot of marketing. They can tell you, oh, oral is as good, but in reality, you're not really having enough absorption to see the results. So there's many products like that.
Dr. Gamboa, God, your show goes by so fast. Dr. Gamboa is with us the last Wednesday at 4:25 Central Time. So it's really easy to keep up with. How do people, you've got a great website. How do people go to your website?
Oh, just go to www.elitecare-clinic.com, and we are here in Las Colinas.
Dr. Gamboa, we love doing the show with you. Hey, stay warm, stay safe, and we'll see you next month.
About you, look at you with a T-shirt.
I don't want to rub it in. I'll see you next month.
Thank you. Take
Thanks,
care.
Dr. Gamboa.
Bye.
That's Dr. Daniela Gamboa. She's in the Dallas-Fort Worth area. And that's going to do it for us today. We'll see you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.